Hello, everyone, and welcome to this lesson in the Choose Your Contraception course. My name is Dr. Candace Elam, and I'm a family nurse practitioner, as well as the founder and CEO of Nursing Current. Nursing Current is a nurse practitioner-led health and wellness coaching and education company that partners with everyday people to restore, optimize, and maintain healthy habits throughout their lives and to reduce the impact of chronic disease and exposure to stressors. You can learn more about the services we offer at nursingcurrent.com. I am thrilled that you've joined me in this topic, which is emergency contraception. Let's get started.
In this lesson, we will define emergency contraception and why someone would want to use it. We'll cover the basics about menstruation, which will help you to understand how and why emergency contraception pills work. We'll talk about the different types of emergency contraception and how to use them. We'll discuss things to keep in mind while you're making your own decisions about whether and which emergency contraception to use. And finally, I'll tell you how to find out about other offerings from Nursing Current. The information in this lesson is intended to provide you with general information about contraception. While I am a licensed healthcare provider, I am not your healthcare provider, and the information that I'm presenting is not intended to replace or act as a substitute for the advice of your healthcare provider. If you're interested in implementing anything that you learn in this lesson, you must first consult with your healthcare provider before taking any action. You may have heard it called the morning after pill or Plan B. You should know that pills are one form of emergency contraception, but they're not the only form, so I'm not going to use the term the morning after pill a whole lot, especially when I'm talking about all of the different forms of emergency contraception. Emergency contraception refers to products that prevent pregnancy after unprotected intercourse. In order to prevent unintended pregnancy, a person has a limited time frame to use one of the emergency contraceptive methods. The time frame ranges from 3 to 5 days after unprotected intercourse, depending on the method used. Why would someone want to use emergency contraception? Well, when I say unprotected intercourse, I'm specifically talking about protection from unintended pregnancy, not from sexually transmitted infection. So if someone has been using condoms according to the label instructions, or if someone has been using a prescribed form of contraception as instructed, then we can say that they are protected from unintended pregnancy during intercourse. However, sometimes intercourse happens before pregnancy prevention is discussed or put in place. If someone has inconsistent condom use, as in they'll begin the act of intercourse without a condom, but then put the condom on right before the male partner ejaculates, then we would consider that unprotected intercourse. Similarly, if someone takes a contraceptive pill, patch, ring, or injection, but is late for their next dose, we would consider intercourse that takes place under those circumstances to be unprotected from unintended pregnancy. These are just some examples, but there are many ways that a person can end up having unprotected intercourse. Condoms break or slip off. You may have consented to condom-protected sex, and then later on you find out that your partner has removed the condom without your knowledge or consent. This is called stealthing, and that's another reason why a person might want to use emergency contraception. Also, there are circumstances where a person is forced into intercourse and they naturally cannot prepare for pregnancy prevention under those circumstances. So there are loads of reasons why someone would want to use emergency contraception. None of the forms of emergency contraception protect against sexually transmitted infection or HIV. There is a chance that a person who had a sexual encounter that was unprotected against unintended pregnancy might also want to protect themselves from HIV after the encounter. This is especially important if you don't know the HIV status of your partner, and this is called HIV post-exposure prophylaxis. If started within 72 hours of the sexual encounter, it can reduce the risk of acquiring HIV. A person in need of HIV post-exposure prophylaxis would need to get to a healthcare provider as soon as possible to get it started because it is time sensitive. You may be able to go to your local Planned Parenthood, Board of Health, or emergency department to get started with HIV post-exposure prophylaxis. You can check out this website, www.hivrisk.cdc.gov, which will allow you to locate an HIV post-exposure prophylaxis provider according to your zip code. The HIV post-exposure prophylaxis regimen involves taking HIV medications for 28 days after potential exposure to HIV, and you would typically have an HIV test before starting the regimen and a few weeks after you complete the regimen in order to make sure that you're still HIV negative. So what's the difference between emergency contraception and the abortion pill? Well, there really isn't much to say on the difference between them. Simply put, emergency contraception does not end an implanted pregnancy, whereas the abortion pill does. Lately, we're seeing people use language that conflates emergency contraception and the abortion pill, and this is just a ploy to restrict access to emergency contraception. Don't fall for it. They are not the same. They do not work the same way. Emergency contraception does not end an existing pregnancy. In order to understand how emergency contraception works and why it might or might not work, it's important to understand a bit about the menstrual cycle. The menstrual cycle is actually 2 cycles happening at once. The ovarian cycle does its thing, and the uterine cycle does its thing, and it all happens at the same time. On average, the menstrual cycle lasts 28 days, starting with the first day of the menstrual period and ending the day before the next menstrual period starts. The menstrual period is the time of bleeding that typically lasts a week or less. After the bleeding, estrogen levels rise and an egg prepares to be released from the ovary. The uterus builds up its lining in order to receive a mature egg. Ovulation takes place in the middle of the menstrual cycle, and this is when the ovary releases the mature egg. At this time, estrogen levels peak and then drop off shortly after ovulation. In the days during ovulation and before menstruation, progesterone levels rise and then drop. Progesterone stops the uterine lining from growing and prepares it for the implantation of an embryo. If pregnancy doesn't occur, progesterone and estrogen levels drop, which cause the uterine lining to shed and the next menstrual period begins. If pregnancy does take place, the uterine lining will produce chemicals that support an early pregnancy. There are 5 main types of emergency contraception available in the United States. 3 forms are pills and 2 are intrauterine devices. Let's jump into the first method. We're going to talk about what we all know as the morning after pill. This levonorgestrel pill is available in the United States under several brands. The most widely known one is Plan B. It's available without a prescription, and there's no age restriction for its use. It should be taken as soon as possible after unprotected intercourse, but it is most effective within the first 3 days or 72 hours after unprotected intercourse. It may, however, be somewhat effective for up to 5 days after unprotected intercourse. If taken before ovulation, it blocks the luteinizing hormone surge, which inhibits the development of the follicle and the release of the egg. It does not prevent ovulation if taken on the day of or the day after the luteinizing hormone peak, and it also does not prevent implantation. The levonorgestrel pill may not work as well in people with higher BMIs. In people with BMIs of 25 to 30, the pregnancy risk is 2.5%, whereas in people with BMIs greater than or equal to 30, the pregnancy risk is 5.8%. So if your BMI is greater than 25, you and your healthcare provider might decide to go with a different form of emergency contraception. Ulipristal acetate is available in the United States under the brand name Ella. It is an antiprogestin, so it delays ovulation and it's thought to thin the uterine lining. Because it works both before and after ovulation, it is more effective at preventing pregnancy than levonorgestrel pills. Ulipristal acetate and levonorgestrel pills are equally effective during days 1 and 2 after unprotected intercourse. However, ulipristal acetate is more effective than levonorgestrel pills in days 3 through 5 after unprotected intercourse. Similar to the levonorgestrel pill, the pregnancy rate with Ella goes up in women with higher BMIs. So in people with a BMI of 25 to less than 30, the pregnancy risk with Ella use is 1.1%, and in people with a BMI of 30 and higher, the pregnancy risk with Ella use is 2.6%. The USP method is a way to use regular combined hormonal contraceptive pills as emergency contraception. The benefit of this method is that it's convenient for people who already have regular birth control pills on hand. You won't have to go make an appointment or head over to the pharmacy. The drawback is that when compared to ulipristal acetate or levonorgestrel pills, this method is less effective and it's more likely to have side effects, particularly nausea and vomiting. It's 56 to 86% effective at preventing unintended pregnancy, depending on the timeliness of use after intercourse. Of course, it works best when used within the first 72 hours, and it is less effective when used 72 to 120 hours after unprotected intercourse. There is no commercially available USP formulation. However, several brands of combined hormonal contraception can be used for the USP method. To summarize the 3 forms of emergency contraceptive pills, their effectiveness at preventing pregnancy depends on the body mass index, the BMI, and the time since unprotected sex. And the range of effectiveness is 58 to 94% effective. They are short-acting and they work best the sooner you take it after unprotected sex. Unless you're interested in getting pregnant in the short term, or unless you are on a long-acting form of contraception, you may want to keep a supply of emergency contraceptive pills on hand just in case you need it. So discuss it with your healthcare provider and see if they could prescribe you some emergency contraceptive pills along with some refills for those pills in case you use them. If you continue to have unprotected sex during the same menstrual cycle, you may still get pregnant. So the emergency contraceptive pill that you took for unprotected sex that you had yesterday cannot be expected to work for the unprotected sex that you have 3 or 4 or 6 days from today. You can safely take emergency contraceptive pills multiple times within the same menstrual cycle, but it is better to start taking a regular contraceptive, like a hormonal contraceptive, because they are more effective at preventing pregnancy than emergency contraceptive pills. Plus, there is less spotting associated with regular hormonal contraception than emergency contraceptive pills. Additionally, if you're going to take emergency contraceptive pills multiple times within the same menstrual cycle, you don't want to be switching between types, switching between levonorgestrel and ulipristal acetate. Because they work in different ways, taking them both within the same menstrual cycle may actually cancel each other out, and neither of them would be effective at preventing unintended pregnancy. So if you're going to use one particular type, then that's it. Just use that type within that menstrual cycle. There are no long-term or severe side effects to using emergency contraceptive pills. In the short term, irregular bleeding can happen within the month after emergency contraceptive pill use. Also, you may have nausea, vomiting, headache, dizziness, breast pain, or belly pain that can happen for 1 to 2 days after taking emergency contraceptive pills. On the topic of menstrual changes after emergency contraceptive use, the menstrual period is generally expected to come within a week of the time when the period is expected. However, irregular bleeding or spotting can happen and continue for up to a month after emergency contraceptive use. If bleeding or spotting continues beyond that, you need to see your healthcare provider to make sure that you aren't pregnant or that something else isn't going on. Also, if bleeding doesn't happen within 2 or 3 weeks, you need to take a pregnancy test to make sure that you aren't pregnant. On the topic of nausea and vomiting, generally speaking, it is not recommended to take a medication to prevent nausea and vomiting when taking emergency contraception, and this is for a few reasons. Firstly, many women, especially those who take levonorgestrel or ulipristal acetate, do not experience these side effects, so there's no need. Also, the anti-nausea, anti-vomiting medications have side effects of their own, so it doesn't make sense to take a medication to prevent a side effect that might not happen, and that preventive medication ends up causing side effects in and of itself. The use-pay method is more likely to cause nausea and vomiting, and it might be reasonable to pre-medicate for nausea and vomiting with this method. Of course, discuss that with your healthcare provider. Regardless of the method of emergency contraception, if you vomit within 3 hours of taking your emergency contraceptive pills, you need to take another dose as soon as possible, and for that second dose, you need to consider taking an anti-nausea, anti-vomiting medication, of course under the direction of your healthcare provider. A final point is that all emergency contraceptives are safe to use during lactation, and this includes the pills that are available in the United States and the IUDs. If using ulipristal acetate, the CDC recommends pumping and dumping the breast milk for 24 hours, whereas Planned Parenthood recommends 36 hours. I wasn't able to find any information to account for that difference, but again, for ulipristal acetate, the recommendation is to pump and dump for 24 or 36 hours. How do you transition from emergency contraceptive pills to regular hormonal contraceptives? Well, it depends. Something you should know about ulipristal acetate is that it works by blocking progesterone and its synthetic form, progestin, which is present in all hormonal contraceptives. Theoretically, ulipristal acetate can block the progestin component of your hormonal contraceptive. So if you're going to start a hormonal contraceptive, you need to wait 5 days. You need to wait to start it until 5 days after taking the ulipristal acetate. Any non-hormonal contraceptive, such as an IUD or a barrier method, can be started immediately after using ulipristal acetate. If you've used the levonorgestrel pill or the use-pay method, you can start any hormonal contraceptive immediately after using your emergency contraception. Regardless of the form of emergency contraceptive pills you use, if you plan to start or resume a hormonal contraceptive, you need to abstain from sexual intercourse or use barrier contraception for the first 7 days or until your next period comes, whichever happens first. Also, after using an emergency contraceptive pill, you need to take a pregnancy test if withdrawal bleeding doesn't happen within 3 weeks. Withdrawal bleeding is probably a new term for you, but basically it's the period that a person would have while on a hormonal contraceptive, including emergency contraception. So what happens is that the hormone levels drop and the person would experience bleeding that is typically shorter in duration, lighter in flow, and less crampy than a regular period. Now let's talk about the morning after pills that are not actually pills. These are the intrauterine devices. The copper IUD is a T-shaped plastic rod that is wrapped in copper and is available in the United States under the brand Paragard. How it prevents pregnancy as emergency contraception is not entirely clear, but generally speaking, it's thought that small amounts of copper are released and the little bits of copper that are released kills the sperm, and dead sperm can't get you pregnant. Another thought is that it disrupts ovum function and it alters the uterine and fallopian tube environment. Taken together, these mechanisms prevent sperm and egg from meeting. The copper IUD, when used as a form of emergency contraception, must be inserted within 5 days of unprotected sex. Actually, the copper IUD is the most effective form of emergency contraception. Fewer than 0.1% of women get pregnant while using the copper IUD as emergency contraception. It also has the added benefit of serving as a long-acting, reversible form of contraception that can stay in place for up to 12 years. Its contraceptive effects are reversed once it's removed. Additionally, its effectiveness is not affected by the user's body weight, whereas emergency contraceptive pills are less effective in women with overweight and obesity. Now, this one is actually hot off the presses. There was a study published in 2021 that shows that the levonorgestrel IUD works just as well as the copper IUD as a form of emergency contraception. What we used to do, and what some healthcare providers still do, is provide emergency contraceptive pills to women who are getting the levonorgestrel IUD inserted but had recently had unprotected sex. This study shows us that the use of backup emergency contraceptive pills is not actually necessary for either the copper IUD or the levonorgestrel IUD. This only applies to the levonorgestrel IUDs that contain 52 milligrams of levonorgestrel, which are available in the United States under the brand names Mirena and Liletta. IUDs with lower doses of levonorgestrel have not been studied for emergency contraception, so we can't say that they're as effective as the copper IUD for emergency contraception. So what is the levonorgestrel IUD? Well, it's a T-shaped rod that sits in the uterus. It contains levonorgestrel, which is a progestin that is similar to the progesterone that your body makes. How it works? Well, when the levonorgestrel pill is used for regular contraception, it works by thickening the cervical mucus and thinning the endometrium. When it's used for emergency contraception, we don't really know how the levonorgestrel IUD works. What the research seems to suggest is that levonorgestrel directly interferes with aspects of sperm function and movement. So, you took emergency contraceptive pills or an IUD and you got pregnant. How could this happen? Well, it's possible that the pregnancy existed prior to taking the emergency contraception, or that the emergency contraception failed, especially the pills, which are less effective than regular contraception or the IUDs, or the pregnancy resulted from an unprotected encounter after using the emergency contraceptive pill. Emergency contraceptive pills are not associated with birth defects when pregnancies occur. If you used an IUD for emergency contraception and pregnancy occurs, you should have the IUD removed to reduce the risk of ectopic pregnancy, miscarriage, infection to you or your fetus, preterm birth, or placental problems. Which form of emergency contraception should you choose? Well, it depends, and obviously I can't answer that question for you. However, you need to discuss it with your healthcare provider and keep a few things in mind that can guide your decision making. Firstly, you want to consider timing. When I say timing, I'm talking about timing relative to your last episode of unprotected intercourse, as well as timing relative to when you're ovulating. Availability and access. Levonorgestrel pills do not require a prescription, and you can get it from the pharmacy. Ulipristal acetate, however, requires a prescription, so ideally you'll have a dose or two waiting for you at home because you've already discussed it with your healthcare provider. It's been prescribed and picked up from the pharmacy. IUDs need to be inserted by a healthcare provider, and you might be able to get in to see your healthcare provider during that 5-day window, but there is a chance that they might not be able to give you an appointment for an IUD insertion on short notice. Just give a call to your healthcare provider and see how they can help you. Cost is definitely something that you'll need to consider. Ulipristal acetate, the medications for the use pay method, and IUDs are covered by most insurance plans. Levonorgestrel pills can cost around $50 at the store or $25 online if you're purchasing it without a prescription. If you're going to buy them online, you want to make sure that you buy it before you need it so that you don't have to wait for it to be shipped, and that might put you outside of the 72-hour time frame when it works best. You also want to think about what kind of contraception you plan to use after emergency contraception. Now, if you've had the copper or the levonorgestrel 52 milligram IUD inserted as emergency contraception, you don't have to worry about a backup method of contraception. If you've used ulipristal acetate, you need to wait 5 days before starting your regular hormonal contraception. And if you've used the levonorgestrel pill or the USPay method, you can start your regular hormonal contraception immediately afterwards. But you still need to use condoms or abstinence for 7 days to prevent unintended pregnancy. You need to consider your body mass index. Both IUDs are highly effective regardless of your BMI. The pregnancy risk increases when you're using a BMI, when you are using ulipristal acetate, the USPay method, or levonorgestrel, and your BMI is greater than 26 or 30. IUDs, when you have an IUD inserted as emergency contraception, they work to prevent pregnancy if you continue to have unprotected sex within the same menstrual cycle. However, we cannot say the same thing about emergency contraceptive pills. So if you use emergency contraceptive pills, you will need to abstain from sex or use condoms for 7 days thereafter, and then put in some other form of regular contraception in place. This concludes the lesson on emergency contraception. I started Nursing Current because I know that patients don't often get all of their questions answered during their medical visits. It's also difficult to know which sources from the internet can be trusted, and there's a lot of misinformation that circulates within our social circles. In establishing Nursing Current, my goal is to teach and coach people about the things that matter to their health so that they can feel confident in the healthcare decisions that they make for themselves in partnership with their healthcare providers. That's what this presentation was all about. Today, you were deluged in information about emergency contraception, and it's a lot to think about. And although you've gained a lot of information, it's possible that you may still have some questions about contraception. I invite you to sign up for the Nursing Current mailing list to get updates on my upcoming on-demand comprehensive contraception course entitled Choosing Your Contraception. In this course, I'll discuss other forms of contraception, such as barrier methods like condoms and diaphragms, non-hormonal methods. I will go into greater detail about the copper IUD, and I'll also cover natural family planning and a relatively new product, which is an on-demand, non-hormonal contraceptive gel. I will also talk about various types of hormonal contraception, including the pill, the patch, the ring, the injection, and the implant. If you're interested in this course, please join the waiting list at nursingcurrent.com. I also invite you to hop on over to Facebook and like the Nursing Current page and join the Nursing Current community group. I really strive to provide you with accurate information about emergency contraception. If you'd like to learn more about the topic, feel free to check out the references that I used to put this lesson together. Once again, I sincerely thank you from the bottom of my heart for joining me. If you're interested in the rest of the Choosing Your Contraception course, please sign up for the waiting list at nursingcurrent.com. Have a great day, and once again, thanks.